Seizure disorders, epilepsy. Epilepsy is a physical condition in which the brain experiences sudden but brief changes in functioning. And the result often is a lapse of attention or consciousness and also uncontrolled motor movements. There are two types of epilepsy. One is the generalized tonic-clonic seizures. They were previously called grand mal seizures, and they involve the entire body. And there are also the type that is called absence seizures, and they were previously called petit mal seizures, and they occur when students appear to blink out for a few seconds. Now, there is no relationship between seizure disorders and academic performance, but students with this disability could experience, being reluctant in interactions with peers because, they would be nervous about their reactions to their seizures, and they could also experience low self-esteem because of this. It is important for us as teachers to let our other students know that epilepsy is not dangerous, and it is not controlled by the student who has the disorder, and it is also not contagious. It could help if the student that has epilepsy lets the other students know, or maybe the parents, you know, if we inform the other students what will happen during the epilepsy encounter. So what can we do when a student has a seizure? First of all, we need to stay calm, and we need to ensure that there's nothing within reach that could harm the person that is having the seizure, if he or she struck it. We also need to pay attention to the length of the seizure, and we need to make sure that the person is as comfortable as possible. And in a school there will be a lot of onlookers probably, but we gotta keep them away. And something that I think we usually think about doing is holding the person down, but we shouldn't do this because we also need to be careful with our safety. Sometimes the person can thrash around, and so we don't need to restrain them. Also, don't put anything in the person's mouth. Most people think that a person with a seizure will swallow his or her tongue, but this is really not the truth. And then don't give the person water, pills, or food until he or she is fully alert. This could be dangerous for the person having the seizure. And if the seizure is longer than 5 minutes, we should definitely call 911. And just be sensitive, be supportive, and ask others to do the same.